And to you, Leanne, and we'll chat about that a little bit later, but I just wanted to comment on what Surtie had to say. Yeah, Upington is the land of extremes. When it's cold, it's freezing, and when it's hot, it's a scorcher. And it's expected to be nice and hot when President Jacob Zuma comes a little bit later today to do the honors of cutting the ribbon that you can see on your screen as we speak, officially opening the Dr Harry Surtie Hospital here in Upington. Now, I'm going to speak to some of the medical professionals who will be making sure that things are spick and span and run as smoothly as they could and should at this particular hospital. I'm joined now by clinical manager Dr. Atkins, as well as matron Margaret Witbooi. She's the nurse manager here at this particular facility. A very good morning to the both of you, and thank you so much for your time. Now, let's talk first about the doctors that will be here. I know there are various clinics that fall under this one umbrella. Perhaps you can speak to us about their areas of speciality, or are they all GPs?
Ayanda, basically this is a regional hospital, so we do what the in-between services between the primary level of healthcare and the extremely specialized healthcare. So we've actually got speciality care here in the hospital, which makes use then of the specialized clinics that we do have. So we've got a wide variety. We have pediatrics, we have obstetrics and gynecology, we have a surgical unit and a medical unit, as well as anesthesia. We have a full emergency room that functions 24 hours a day. And then we have our outpatient clinics with all the allied support as well that helps us with full patient management.
Matron, nurses often get such a bad reputation for the services, but very few people know that they're often working under difficult circumstances and are inundated with patients. The ratio between supply and demand, very, very imbalanced. Perhaps could you speak to us about the challenges that you personally have experienced, that you're running up or heading up the nurses here as a nurse manager, some of the challenges and areas where you can improve on, and going forward, what you'd like to see the nurses accomplish here?
Ayana, I want to start by saying before we came to this hospital, the morale of the staff was a bit low. It was mostly due to the staff shortages as well as equipment shortages, and the facility was not that good, It wasn't in a good state when we left there. But now since we moved into this new hospital, the new facility, we employed new staff, we got new equipment, and since then, I think the morale is very good now at present. We're trying to keep them updated with the latest. We do everything in our power, that we can to get the morale of the staff, and I think we've succeeded in it, because now they are more. You can see at the back we've got new uniforms as well, and it's just a pleasure to work in this institution. And what we also do is to our staff, to get them They get the opportunities, to study further. We give them bursaries, from the department, and even study leave they get, so that they can succeed in their career as well. So we're doing well at this institution, I think, at this stage.
So the only glass ceiling is the literal ceiling, and not when it comes to the profession. That's very good that they can study and further themselves and improve themselves. The doctor, let's perhaps speak about the systems that are in place now. As clinical manager, perhaps you can just give us some advice with regard to that. Some facilities for the disabled, for wheelchairs, perhaps the card system of people queuing lines. Speak to us about the systems that are in place.
Well, basically, if we look at the disabled systems, this hospital is fully equipped to handle all disabled people. We try and keep most of the patient-related facilities on one level, so that there's no need to negotiate stairs. Where there are stairs, we do have lifts in place, and all areas are wheelchair accessible, which helps a lot. It's just unfortunate the hospital is really, really, really big, so you've got to walk quite a way. So if you come with your wheelchair, maybe someone should come and help you just to push it. Otherwise, you might get tired along the way. What our other systems are, we do have a computer system. It's not 100% fully operational yet, but we are working on that, and hopefully within the phase 2 that we are busy with opening the hospital, things will be much better there. For the time being, everyone comes in mostly on a booked basis, so you get an appointment to come to our clinics, to the hospital, and you come in, you collect your file at the reception, and then you go through to your specialized clinic where you should be, and there they will categorize you as first come, first serve. I must say, generally our waiting times are quite low for our clinics, and usually by mid-afternoon everyone is sorted out and everything is in place.
Now, rule number 101 when it comes to journalism and in life, I think in general, is never to judge a book by its cover. But I'm judging you by your accent, and something tells me that perhaps you may not be from around these parts. I could be wrong, you can correct me. But let me speak to you now in your personal capacity as medical professionals. Tell us about your journey and how it is that you are now in this place, and some of the challenges that you found along the way, and even some of the rewarding aspects of your career.
Okay, well, you could judge correctly. I'm actually from KwaZulu-Natal originally, so that's where I was born and raised. And after completing my school career, I went on to study medicine, and during that time I actually developed a passion for children and pediatrics. So I'm actually a qualified pediatrician, and because we have a vacancy in the post of clinical management here, I'm helping Mrs. Bekus, our CEO, with a lot of the administrative duties in that regard. But my primary passion is children and child health, and that's what keeps me going here. And in general, the challenges are basically poverty in our country and what it does to our children. So we're really working a lot on that with our district teams in the district here. We're trying to improve on what we can there at district level. And challenges from a hospital side is staffing. I don't know if Mrs. Bekus may have said something earlier, but we do have challenges to recruit medical professionals to the area here. And I think a lot of people think of the extreme heat and they just run away, and they think we're a little town in the desert, which is actually not true as well. So, and the challenges are actually getting people who want to be motivated and come and work here. But from my experiences clinically, what we see here is absolutely amazing. The changes that we've made in some of the children's lives here. Children that come in very malnourished and sick, that you think will probably not make it no matter what you do for them, and they actually end up going home in a better condition than what they came in, and that makes the job worthwhile.
But over the years, we've seen a mass exodus of medical professionals leaving South Africa for greener pastures overseas. South African nurses are in demand in other parts of the world, and they get paid much higher for their services. What has made you decide to stay here and add value?
You know, Anna, I moved here in 1980, when my husband opened a private practice in Upington. And since then, that was 1980. In 1983, I started working at Dr Hospital. And, I can't see myself in any other career than nursing. I don't know if I'll ever do anything else, because I love being with patients and I love being with my staff. As you see them at the back, we have a very good understanding and they respect me, and that is that I appreciate very much, because the respect is there and they listen to me. Even if I'm old now, they still listen to me when I speak to them. And Upington is a good place to stay. They say if you drink the water of the Orange River, you won't go anywhere else to drink water, and that is so true in my case. I've come here, I studied in Cape Town, and when I came to Upington, I was qualified, but it didn't stop me from studying further. And so I had a lot of other studies. My BCur I did in Upington, through UNISA, and then thereafter I did some more studies. I don't want to mention all that because I'm not using most of them, but I'm in the nursing administration at present, and I enjoy what I'm doing.
I love it. May you continue to serve the people with that passion, because it's key to productivity and fulfilling your purpose and mandate. Thank you so much for having joined us on this chilly morning that's set to warm up. I understand Valen is in studio, someone else who's extremely passionate about what they do.